corroborated by the serosurveillance which we have undertaken to monitor the trend of this SARS-CoV-2 infection transmission. Now, what is a serosurvey? A serosurvey, we collect blood samples from a general population and test them for IgG antibodies. And if the antibody test is positive, it means that the person has been infected in the past. And what do we expect from these serosurveys? We expect to see the percentage in the general population, who is at a higher risk of getting infection, which are the areas which need more contained efforts, which need to be strengthened. And the objective is to provide scientific guidance from time to time, and that is the purpose of this one of the very early surveys that we have done, and multiple surveys will be done as we go on to guide. And similarly, we have been providing the scientific evidence either through the National Task Force or the Joint Monitoring Group to the government, which is the National Task Force chairman is Dr. Vinod Paul, and the Joint Monitoring Group is chairman of the DGHS, and we've been providing scientific evidence. So now let's come to this serosurvey. So this was the first serosurvey conducted in May in collaboration with the state health departments, in collaboration with the NCDC and the WHO. And basically it had two parts. The first part was to estimate a fraction of population to be infected with SARS-CoV in the general population, and that is the part that is completed at the moment. And the second part is to look at the prevalence of this SARS-CoV-2 infection in containment zones in hotspot cities, and that is ongoing as we speak. Now, the data was collected, as I mentioned. We took it a written informed consent and ethics clearance, and 3 to 5 ml of venous blood was taken, and then this sera was evaluated for the Ig antibodies by the ELISA test, and this ELISA test is also being made available to the states to carry out serosurvey in different groups of individuals within their states. Now, in this, the part one of the survey, which is complete, we had was a population-based serosurvey in which several districts were studied and divided into 4 groups, and in each group, whether it is 0 prevalence by RT-PCR or 0 to 5 or 5 to 10 or more than 10% per million cases in different districts, were divided into 4 groups, and 15 districts were in each group, and 400 individuals were studied from each district. And then from each village or urban area, we selected 10 villages and 40 adults, and every household one adult was studied. So we actually studied about 83 districts in the country, and number of households that were visited were 28,595, and we were able to collect the blood samples and the data from 26,400 individuals